at University of Auckland. He is a vascular surgeon and the Director of Trauma Services, the Auckland City Hospital, New Zealand. Please welcome Dr. Ian Dolan Shepherd Civil, who will discuss on war and medicine trauma collaboration between New Zealand and Asia. At the same time, I also want to announce that Dr. Kamal Jayasurya from the Sri Lanka will be the reactor for this session. To give his reaction on the same topic, is a general and trauma surgeon at the base hospital, Dambulla, Kagle district, Sri Lanka. Dr. Kamal Jayasurya is the director of the National Trauma Management Course of Sri Lanka. Welcome, Dr. Kamal and Dr. Ian.
Good evening, everyone. I'm Ian Civil. I'm the clinical director for the New Zealand National Trauma Network, and I have been asked to give this presentation on trauma collaborations. And as you will see, I'm going to focus mainly on a subset of countries, as my experience is not that great with some others, but outline the links we have between my country, New Zealand, and Asia. So, looking to the Asian collaboration, I had no idea, I must admit, that it was such a broad church of countries from far and wide. And certainly my personal experience is that I've only visited 8 of these countries out of the 19 that are listed here. So I'm going to limit my comments to the relationships between New Zealand and Singapore and Malaysia, and use these as examples of what has happened between other countries in the Asian collaboration and the wider Australasian group. And I'm thinking to reflect on military links, visiting fellowships and professorships, courses, conferences, and learning opportunities. So, of course, the experience between Asia and New Zealand is not only historic, but current as well. And in her very first overseas trip from New Zealand post-COVID 2 years ago, Jacinda Ardern chose to go to no other place than Singapore. So the links are very current in that direction, as well as historic. And of course, they're historic because of the Commonwealth, of the background of links to the UK, of military conflicts in that area. And apart from the major world wars, New Zealand was involved in the Malayan emergency, which didn't happen that much longer after the Second World War ended, and in the Malaysian confrontation, which was a bit later. And Singaporean troops regularly train in New Zealand, and this line in the bottom left is a unit training in Waiouru. And the text on the bottom right indicates the ongoing focus of the links between New Zealand and Singapore, and unfortunately sometimes that's associated with a lot of non-military publicity. Particular Aloysius Ping, who was training in New Zealand and got injured and died in the hospital of one of my colleagues, Grant Christie, in Waikato. And on the far left, there is a picture from the Christchurch earthquakes, where Singaporean military troops came and provided support. Now, with all of these military links, as everyone knows who's been in the military, you send medical support. So with each of these involvements, there has been ongoing medical support between New Zealand and those Asian countries. Reflecting on my personal experience with Singapore and Malaysia, and you will know these people, it goes back to 1994, and obviously from the fact that I'm giving this presentation is current. Ming Turk on the left there is, of course, the person who encouraged me to make this presentation. So I'm thinking of him relatively fondly as I make this presentation. So my links are both with Malaysia going back to 1994 and in particular in Singapore 2015 in relation to visiting fellowships or visiting professorships. When I first visited Malaysia in 1994, I was a relatively junior consultant at Auckland City Hospital and the University of Auckland and was chosen to visit Malaysia for a couple of weeks to tour hospitals and comment on trauma systems. And I suspect if I was asked to do a similar thing today, that would be where my expertise lay. Similarly, my experience at KTP Hospital was largely to do with trauma systems. This was Malaysia in 1994, and there is a young Hisham Abdullah, a very junior surgeon at the time, who was given the onerous task by the president of the college at the time of hosting this young New Zealand surgeon and taking him around Kuala Lumpur and also to Kuala Terengganu to see hospitals, to experience some of the countryside and to get an understanding of how trauma care was delivered. And the relationship that we formed on that one occasion, which is over 20 years, has remained steady. And at various stages, we've crossed paths, both at our college meetings and at various other events. And I put the comment out there about Hisham, and even here in a much more senior role, Dr. Noor Hisham Abdullah, an email from a few years ago now, but outlining the goodwill between our two countries and between our healthcare services. And so the collaborations that come through multiple years and positions, they continue. They don't just stop because of the one event. With regard to the KTP hospital in Singapore, lovely hospital. I wish we had hospitals that looked like this in New Zealand. Lovely green hospital. I was worked hard, and if I can show you up the top there, met with lots of other people other than just those who were at KTP hospital. But the experience of being in Singapore as at a visiting professor level is also an important collaboration that happens between, and I'm sure it's happened many hundreds of times between surgeons in Australia and New Zealand and various hospitals throughout the countries that form part of the Asian collaboration. Conferences are a big feature of our sharing and collaborations, and there are lots of examples around the collaboration, but particularly in Singapore, experiences of attending the Singapore Trauma and Acute Care Conference on at least one occasion. I think I may have gone on more than one occasion, as these are usually linked to the Tan Tock Seng DSTC course. Our college, the Royal Australasian College of Surgeons, has in recent times had two combined meetings. The first in Kuala Lumpur in 2012, where I was the outgoing president at that stage, and it was a great opportunity to be present and link in with Malaysian surgeons in the delivery of a multidisciplinary College of Surgeons conference. And similarly in Singapore in 2014, we had the opportunity of sharing not only with our Singapore colleagues, but also with the Australian New Zealand College of Anaesthetists, and there was a fantastic collaboration across all of the societies that work in those areas. With regard to courses, obviously ATLS is run in both countries and in many, if not all, of the countries in the Asian collaboration, and they run effectively, and the links are through the regions of the American College. For us in this part of the world, it's region 16 of the American College, and at various stages, various members from Australia and New Zealand have chaired that region 16, and created links between the countries that run ATLS in this region. With regard to DSCC, there are a number of countries. Personally, I've only been involved in Japan and in the Tan Tock Seng Hospital, but opportunities to link across surgical practice exist through this particular course as well, and have occurred on many occasions between the relevant groups. More specific one-on-one collaborations relate to fellowships, and in my hospital we've had the opportunity now to have 4 surgeons or emergency physicians from Asia, from Malaysia or Singapore, and the first of these was Rizal Alwi. Rizal came to us from Johor Bahru and was a fellow in trauma emergency services at Auckland City Hospital in 2010 and 2011. And we formed a very close bond that has continued. I've watched his family grow up, and we've enjoyed medical collaborations on a number of occasions. It's worked in reverse, and I had the opportunity to visit his hospital and give some talks to his staff and see some of the ways that he practices trauma surgery in his hospital. Yvonne Puni came to us similarly from Johor Bahru in 2019 and 20, and she was a general surgeon in Johor Bahru as well. It was a great asset to have Yvonne with us over this time, as of course this was when the first round of COVID struck, and it was fantastic to have some additional staff who really enabled us to get through with all of the isolation and cohorting and things that we did at that particular point in time. And Sunda's probably watching this presentation. Sunda has just returned to Singapore, having been a fellow in 2021 and 2022. And again, a great asset and a great link between our 2 countries in the practice of trauma surgery. And branching out a little separately, we've presently got Sohail Pothiwala, who is an emergency physician from Singapore. He is working across both our surgical trauma service and the emergency medicine trauma service to provide learning opportunities in both of those areas. So the trauma collaborations between New Zealand and Asia are long-standing over many decades. They're based on historical political links and relate initially to defence and wartime collaborations. However, they've provided contemporary medical links for training and education, and there is real mutual support in both local and international activities, with ATLS and DSCC being just one example. I'm sorry I'm not with you in person or not even live giving this presentation, but I am involved at the time that this will be shown. I'm involved in teaching an ATLS course out of town, and I hope the session goes.
Professor Ian Civil, consultant vascular surgeon. I'm not sure whether he is listening to my reaction, but it is specifically from a training point of view, very important aspects that he pointed out, especially the Singapore and Malaysia. So a journey from mind to heart, that was a big meaning. So what is the mind and what is the heart? I think Professor Ian Civil was the president of IATSIC in 2007 to 2009, if I am correct. So as Professor Ismail Saidmoon said, this ACT, Asian Collaboration Trauma, started as Singapore Trauma in 2005, and it became Malaysian and Singapore Trauma and ASEAN, and it's become now Asia. Now we have our own trauma organization. So Professor Ian Civil specifically mentioned Singapore. So I am also very interesting. Actually, I would say that my second home is Singapore, because I train as a trauma fellow in Singapore Tan Tock Seng. So he has done this presentation in several parts, that is military links, courses, conferences, and fellowships. So most of the Sri Lankan surgeons got the membership in ACT and work on ACT from 2012. And most of our doctors, most of our surgeons train for trauma in Singapore and of course in New Zealand as well. So New Zealand has given the training for our fellowships. Our surgeons train there for overseas training, and it is a big achievement for the College of Surgeons Sri Lanka. And specifically, Professor Ian Civil, I don't know whether you can remember. I'm sure you visited to with the invitation of College of Surgeons in 2010 to Sri Lanka. And that time, the College of Surgeons president was Dr. Ranjit Tellawal. Now, he is the global chair of National Trauma Management course. It is under the auspices of IATSIC. So you were just after the presidency of IATSIC, you visited Sri Lanka. And 2010, the year that we established National Trauma Management course in Sri Lanka. So the journey from mind to heart. So our heart is our country. Actually, the knowledge and the participation of the kings and giants of trauma visited to our country and visited to Singapore, and we got together as an Asian collaboration. If I give the message to all of you, now we are training about 400 doctors per year with National Trauma Management course. And we have developed a course for nurses with the members and the faculty of National Trauma Management. And we are going beyond the initial resuscitation as decision-making of major trauma. So for starting all of this, your collaboration and your help and everything got together to start this, especially these training programs in Sri Lanka and fellowships for Sri Lanka. So I must mention this initial part of the Asian collaboration trauma, as mentioned by Professor Ian Civil, which he visited for DSTC and ATLS in Singapore and Malaysia. For Sri Lanka, we brought the ATLS. Actually, Singapore was the country helped us to develop initially the requirement in Sri Lanka. So we have now guest faculty and international faculty for DSTC as well. So thank you very much for your presentation, mentioning especially the hub of Asia for trauma, the Singapore. And I respect and I'll give my big thank on behalf of the College of Surgeons Sri Lanka and as the Director of National Trauma Management course for your contribution over these 10 years and a journey from mind to heart. Thank you, Professor Ian Civil.